Thank you. Distinguished analysts on the dais, members of the organization in this auditorium, experts, medical practitioners, and friends from the industry. It's a very great pleasure to be here at this kind of an event, because every time that you attend these events, there are far more things you get to know than would have known otherwise. So it's a learning experience each time you come to these things. And thank you, Vicky, for the HEAL series. And thank you for creating a platform where we can continuously try and work together, the government, the industry, the medical practitioner, to see what is doable in the health sector and actually talk about what we can really achieve. We were just, when we were coming, we were discussing how people have got stuck in the rain, and there were many things being said, including that we are moving towards smart cities and we are not able to even move. When we talk about re-engineering, we really get lost in big ideas. Everything will happen and sustain itself only if we get the basics right. Particularly so with the health sector, where Mr. Munjal was also mentioning, there's so much within ourselves that we need to get back to the basics, do them correctly, then think of the greater ideas, and they'll automatically fall in place. We will not have to strive that much harder to get them in place. So it's about the basics that we really should be talking. Mr. Munjal was talking about not being so concerned about the kind of investment that we get in the healthcare. I do agree to an extent. There is a need in the healthcare sector for more money. We need more money for health, but all of us should collectively be responsible for more health for money. What is the kind of accountability system that we have put in place to get the returns of investments that we are putting in place today? It's a critical thing that we need to consider. I've had very eminent speakers before me, and they have touched on every critical aspect of the healthcare industry. And this is one of the great ease of speaking at the end. So I'll not get into the basics of the healthcare system and the way it's happening in India, but confine myself to a few thoughts that I have, and I thought I'll share with you, and would be extremely, extremely happy if I can have your response whenever you can to whether you agree or you think it needs to be done differently. This process of dialogue must continue, otherwise we'll lead nowhere. I'll also not get into the basic things of where India stands as far as healthcare is concerned and what are we doing in healthcare in India. Because I do expect that every member present here knows that extremely well. If we don't, we are barking up the wrong tree. Then we are re-engineering, rethinking about a situation of which we are not aware. Therefore, one of the basic things that we need to re-engineer in India is the thought. Whenever we discuss healthcare in India, and today is no exception, there's a huge debate on the challenges that face healthcare in India. Yes, there are many problems. We talk about the poor health indicators, we talk about high out-of-pocket expenditure, we talk about lack of accessibility, lack of quality. And we talk about all these with a great sense of despondency. What we do not do in India, while all this is correct, what we do not do in India is look at the brighter side and celebrate some of the successes that the healthcare in India has got. It is not for nothing that the maternal mortality rate drop today is faster than the world. It is not for nothing that you have gained success over many, many things which nobody in the world thought you can do it. But we've forgotten to celebrate these. And one of the reasons why we are not able to move very sharply in healthcare is we are only looking at the challenges and we think we are plagued only with them. And another reason why particularly this gathering there is an issue is we do not focus on what is happening in the basic heart of the country. We really need to look at that very seriously. And if there are challenges there, we need to overcome them, find solutions to that. Therefore, I would tend to think that there is every reason to feel good about what has happened in the healthcare delivery system. There's every reason to feel good about the pharma industry in India. There's every reason to feel good about the new technologies that have come up. Yes, we need much more, and we should together certainly be working on that. Healthcare in India really is a dichotomy. On the one hand, the world says that it is the only destination which offers world-class healthcare at an affordable price. On the other side, for our own people, the access is becoming more and more difficult. The technologies that you talk about, the quality of healthcare that you talk about when the world sees you, is actually not reaching our own very people. And that is where we need to think very hard as to how do we translate that into the area which is underserved and where it is most required. We really can't think of a healthy India in terms of cities and the 20% of the population. Mr. Munjal spoke about the young population, 253 million adolescents today. If we do not take care of them, they are going to be a liability and not an asset. That is how we need to really put our thoughts together. Well, there are many thoughts which saying that health sector in India is a crossroads. No, it's not. You are at a crossroad if you don't know where to go. I think all of us know where we want to go. And all of us have seen that road. It's just that the efforts that we have made has not made that journey that much easier. And that is why we feel a little lost. It's not the direction. It's the effort not bearing that kind of a fruit that makes us feel at a loss. We need to put our act together in this. It's about maximizing health outcomes with the resources that we have. It's about really overall transformation of the healthcare industry that we are talking about. In this context now, since you are discussing re-engineering, let me just share a few thoughts that I have on what should really we mean by re-engineering. There could be many, many more ideas, and as I said, I would be extremely happy to have them. Largely, I would put re-engineering in India on 3 pillars: people, processes, and technology. If we can re-engineer our thoughts around these 3 pillars, I think we'll be able to get to where we want to. Re-engineering should be actually about radical improvement in healthcare delivery system, about reaching healthcare to people. Re-engineering in becoming patient-centric. It's about care. And we need to really look at some reassessment of also our fundamental healthcare system that exists in the country. Both from the point of view of a public health delivery system and also industry-led delivery system that we have in this country. We need to really re-engineer our thoughts towards new technology. And equally important is adopt these technologies, not just create technologies. There is a gap in this country between the availability of technology and use of that technology, and that is where we need to put our thoughts together. How do we effectively use that technology? I have always maintained that quality of healthcare in India, there are 3 large pillars that we kept talking about: accessibility, affordability, and quality. Access, to a great extent, even in a remote rural area today, we've been able to establish to some extent. But the kind of healthcare service that we are providing to those people in those areas is not quality healthcare that we would like to provide. So entire process of re-engineering should be towards thinking how do we get in that quality element, and what is the partnership that we need to build between the public and the private sector to do that. It is not possible for either of the segments to do it alone. And whoever said that healthcare delivery in rural areas was just a government business? It's not. It's everybody's responsibility. And it is the government's responsibility to ensure that they take others along as they try to deliver. And hopefully, we will be able to create that platform where we can work together. You know, we spoke about the disease burden. There's a lot of thinking about the NCDs that are a recent spurt. The answer to NCDs is completely different from what we have been doing so far. Unfortunately, India has a double burden. We have equal amount of communicable diseases also going on simultaneously in the country. But non-communicable disease is a perfect example where partnerships will work, where new ideas will work, where community will work, where society will work. It's about lifestyles more than anything else. And that brings me to the issue of preventive health. That is critical. In all big gatherings, we talk about hospital care. I would like to spend much more time on healthcare than talking about hospital care. All our energies, our resources should be spent on creating less hospital care and more health care so that there is less need of hospital care subsequently. Why are we waiting for people to get sick so that we can create facilities? I mean, this is something that we've been thinking but not been able to do effectively. And one of the reasons why we are not able to do very effectively is we are a huge country. The numbers often frighten us. You know, when I earlier spoke about celebrating success, let me share with you a tremendous amount of experimentation, innovation is going on in the States. There's huge amount of things that is happening and people are doing it and successfully doing it. In fact, yesterday and day before yesterday, and part of it today as well, we have a national seminar on best practices going on in Andhra Pradesh. And believe me, we got 246 new experiments which the states have done. And we had a tough time, getting it to 50 so that the presentations could be made. So there's a lot happening in the states. The problem is that this is happening in just that state, that district, that block. We just don't move beyond it. So the partnership between government and private is most critical in scaling up pilots in successful experimentation that we are doing. In healthcare, more than anything else, the critical element now is innovation. And I have been telling all the state governments whenever I meet them that there is absolutely no reason why we should not budget for failures when we innovate. Let's take that as a given. But that should not deter us from innovating. But then government has its limitations in innovation. Much more of it needs to come from the private players, from the industry. But a standalone innovation from the industry which cannot fit into the system of our organized healthcare will not add value to the system. We must innovate and ultimately become a part of the system if we want that to succeed. So these are things we need to really do in whether it's best practices, innovations, experimentation. Lastly, I would just like to leave a thought with you on two concepts. One which everybody is familiar with and everybody is working very hard on, and that is the Make in India concept. Medical devices, pharma, whatever it is. But the second concept I want to leave with you is Made in India. In healthcare industry more than anything else, the moment we come across a problem, we start looking for international solutions. It is a great thing to learn from international situations. But please also imagine India, where we can't have the same solution for 2 states and we are talking about an external solution for the entire country. Therefore, we need to look at international experience, but draw from our domestic learnings of our past as to how we want to re-engineer our healthcare system. If we can do that, I think we'll be far more effective. And most critical in this entire journey will be the fact that we need to work together continuously on an evolving basis and on an institutional basis. Unless you have an institutional framework which is laid down, partnerships do not last. So if we want to have a lasting partnership between different stakeholders, we need to together create an institutional framework. Ladies and gentlemen, it's a huge opportunity in healthcare, a big one. If we do not act together today, we'll perhaps miss it. And there is no reason why we cannot do it. Thank you very much.